begin.
Hello everyone, and welcome back to my show. I'm Dr. Lot from Acupuncture is My Life. Now in this episode, I'd like to discuss why an individual can experience a mild headache once they've contracted a cold. Now I've been asked by several individuals as to why this is the case. Isn't a common cold simply an upper respiratory infection? Can the headache be a result of COVID-19 and not the common cold? Many are concerned about catching a cold during this time of year because of the present COVID-19 pandemic. Now, let's first attempt to gain an understanding as to why the common cold can cause mild headaches. You see, it is believed that most headaches that occur once you've caught a cold tend to be as a result of swelling of the sinuses. You see, your sinuses are basically a group of cavities that lie behind the nose, the eyes, the cheeks, and they produce mucus to help rid potential pathogens that attempt to enter the body by lodging in dust particles, microorganisms, or other substances which generally attempt to enter the body via your nasal passages, your eyes, or mouth. Now, as mucus builds up in an attempt to wash bacteria or viruses clear of its entry point, your sinuses tend to become inflamed as a result, whereby the swelling and inflammation would then cause you to experience a headache. Now, in some cases, these inflamed sinuses tend to put pressure on the fifth cranial nerve, which tends to cause pain behind the face. Now, understand that not everyone will experience a headache with the common cold. Of course, I was asked as to how would an acupuncturist diagnose an individual experiencing a headache as a result of becoming infected with the common cold. Well, a headache as a result of catching a cold in Chinese medicine is generally considered as a result of the body having been invaded by an external pathogenic factor. The more common external pathogenic factors tend to be wind and dampness. As I've stated in previous videos, wind tends to affect the upper part of the body, which more times than not tends to cause headache, which can occur along with symptoms of invasion of wind cold. The other pathogenic factor that can cause headaches can be dampness. Now, although dampness usually affects the lower part of the body, dampness can easily affect the middle jiao, which consists of both your spleen and stomach in Chinese medicine, and can rise upwards to the head from the middle jiao, obstructing clear yang from reaching the head and keeping the head's orifices clear, which can result in a headache. Now, some individuals experience headache at the top of their head. This is most often due to deficient liver blood not being able to reach that area, because in Chinese medicine, the liver channel is the channel that goes to the top of the head. Now, this type of headache usually presents with or as a dull headache by which an individual feels better once they lie down. Now, there can be other causes for this type of headache unrelated to the liver channel, such as qi and blood deficiency or heart blood deficiency. Now, some individuals can experience headaches as a result of an invasion by an external pathogen on the sides of their head, in which this area generally corresponds with the gallbladder channel and can possibly be as a result of liver yang fire, liver yang rising, liver fire, or even liver wind. Now, I could tell some of you guys are like, what? If you're confused at the slightest, please take a moment to watch my earlier episodes on the basic functions of the liver as well as the basic functions of the gallbladder. Or go to acupuncturismylife.com and click on Understanding Acupuncture and review the write-up on the liver and gallbladder channels to get a better understanding as to what I'm talking about. Now, some individuals can also experience headache on their forehead as a result of an invasion by an external pathogen. Now, this type of headache tends to be related more so to the stomach channel. Now, if the headache is dull in nature, this can be due to stomach deficiency. If it is sharp, it can be as a result of stomach heat. There's so much more to the different types of headaches and its causes that I plan to do an entire episode on headaches so that you may gain a better understanding as to how headaches can be diagnosed by an acupuncturist. Now, let's take a look at a wind cold case I treated earlier this year, which had similar symptoms of common cold in Western medicine. The patient presented with a headache and stiffness at the back of the neck. Now, to me, the headache was obvious as having an acute onset, and it was severe due to impeded circulation of defensive qi, which also presented with generalized body aches. There was also a version of cold with fever, shivers, cough, sneezing, and a runny nose with a clear, slightly white nasal discharge. I knew in this gentleman's case I had to release the exterior, expel wind, scatter the cold, and remove any obstruction from the channels. So I needled points on the lung channel to release the exterior and expel wind cold. I needle points on the gallbladder and bladder channels to expel wind from the head and release the wind. I also needle points on the governing vessel to support expelling wind from the head as well. The patient fared pretty well after just 2 sessions of acupuncture, as I'd also informed him to stay in touch with his primary care physician to keep her informed as to his progress. Now, if you ever have any questions or would like to engage in a private chat regarding any concerns or ailments you or a loved one may have as a result, or as to if acupuncture can be a benefit to you, simply go to the Google Play Store and download the Acupuncture is My Life app to learn more about acupuncture, Chinese herbs, and plant enzymes as well. Now, don't forget to subscribe to this channel to be notified as to when new episodes are uploaded to this channel. And until next time, acupuncture is my life. What's yours?